Hey everyone, I'm Dr. Matt Sherwood with Sherwood Spine and Sport. Today I'm going to be going over another great exercise to increase mobility in the hip, and this time we're going to be dealing with hip adduction or hip adduction. So what is hip adduction? So in simplified form, if I were to take my right leg and bring that leg across the center of my body, that is hip adduction. Another more functional way of looking at this would be if I would keep my right foot planted and then I would just shift my pelvis over toward that planted leg. That requires hip adduction of this right leg. When do we need that motion? Well, we need it just for walking. So during stance phase of walking, where our foot is planted, our pelvis will naturally shift over that way. So if you have a limitation in motion in hip adduction on that side, that can pose some issues. So common symptoms you might be experiencing if you have a limitation there would be what we'd call a hip impingement. So you get pain in the groin, and that can be with squatting, it can be with taking stairs, even bending forward if it gets bad enough. This is also a very common motion to lose with hip arthritis, so osteoarthritis. That's a very common motion to be very limited. One way to see if that might be limited on you very quickly, this way is a little trickier just because it requires some balance, but if you put hands on the hips, take the leg, and then you're gonna bring it slowly across the body, try to get it planted on the other side of the planted foot. So I'm gonna bring my right foot across and then try to get it flat next to my left foot. And then we would just do the same on the other side. So now we bring the left one over. And what you're looking for, you'll notice if it's limited, you might have a harder time. You have to labor more to get it over across. Maybe you can't even get it across. You might have a strain in the groin, or you might actually have a pinch in that groin area like I was talking about before. So now I'm gonna go over a nice quick exercise for you guys to do that usually will show results incredibly quick. All right, everyone, so here is the starting position for our exercise to increase our hip adduction. I'm gonna be doing it on my left leg in this case. The left foot needs to be completely flush against the wall. You're not having just your toes on it, just your heel. The whole entire foot needs to be against the wall. The right foot is going to be staggered as far as you can comfortably. The toes need to be in exactly a straight line. We can't have our left foot against the wall and then this one is up here or back here. It needs to be completely straight and even across. Very nitpicky. Now, the whole purpose of this is we want to really get our lateral hip muscles or some of our glutes firing on this. So we're going to push that left foot hard into the wall. It's essentially doing this into the wall, using it as resistance, like we're trying to push the wall away from us. As we keep that hard contraction now, we're just going to shift the pelvis away from that wall, push harder as you go, push, 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 and then you go back toward the wall. It almost will feel like this is cramping. The muscles are working so hard. Important detail here is when we shift away, if the hip is tight in this motion, you're gonna naturally wanna bend the shoulders this way. The shoulders and pelvis have to stay completely on the horizontal. There's no tilting. So we're not pushing away and doing this. We're keeping everything flat and just transitioning the pelvis away from that side. If we look at it from this view, my left foot's pushing. We want to make sure that we're not translating forward so that knee's going over that foot, because that puts too much strain on the knee, and then we're bypassing using our hip. So nice and even here, we push away, and as we shift away, we kind of sit into that hip so the knee's nice and lined up there, and then back. So again, 10 to 15 reps of that, usually 2 times a day. And then if you recheck what we went over previously where we kind of crossed the leg, lots of times, unless you have like a really bad situation going on there, you should notice that motion is much more fluid and a lot easier to perform.